Hello, I'm Leslie Bolello, the Program Director of the Harvard-affiliated Emergency Medicine Residency here at Beth Israel Deaconess Medical Center. We'd love to welcome you today for a tour of our emergency department. You'll get to meet some of our wonderful residents and nurses along the way. Thanks for joining us and hope you enjoy.
Hi everyone, my name's Amanda. I'm one of the residents here. Welcome to our resident lounge. This is our home base when we're not working down in the department. A lot of us hang out here before and after shift, or even when we're off service, and we have some free time while we're in the hospital. We have a couple features. We have a bunch of computers behind us with lots of Dragon dictation hooked up to them, so that makes it really easy for us to be writing notes after shift. We also have snacks in our cabinets, which are great when we need a quick pick-me-up, even during shift. Also, we're right above the emergency department, so we're just one staircase up. It's really easy to get up here before and after shift, or even sneak up here during shift. And then we also have just some furniture. We also have a budget to kind of furnish this place however we want. It really is truly our space, which is really nice. In addition, we have some artwork. We have pictures of ourselves from different events and fun times that we've had together. And we're also located in the middle of a bunch of the administrative offices, so we have easy access to all of our faculty whenever they're around. A couple other nice features of our residency is that we also get some money. We have money called Carlo Bucks, which is money that we can use in the cafeterias in this hospital as well as across the street on the East Campus. We also get educational funding to use on educational resources such as online resources or textbooks. And in addition, we have funding available to support us if we get to go to one of the conferences, one of the academic conferences anywhere in the country.
Hi, my name is Crystal. I'm one of the residents here in our ED. I'll be talking about the observation unit. In our ED, we have a dedicated observation unit for any patient who we think doesn't warrant admission criteria, but we would keep in the ED for 2 stress tests, for example, in the morning, or somebody who we think we just need to keep a little while to watch. When you take care of obs patients here as a resident, you'll work with one Team 3 attending who's dedicated for observation in the morning, and you'll work together to try and dispose this patient. So this is a great exercise as a resident to practice taking care of obs patients in addition to new patients. Right now, our observation unit is serving as a COVID unit, so it's just a hallway with 8 beds where we're keeping all of our patients who we want in a more isolated area. So it's adaptable depending on the circumstance.
Here we are in our green-purple zone in the ED. Our green-purple zone is where we have a lot of our lower acuity patients, our 3s and our 4s. I'd also like to point out that behind me we have a room back there where case management and social work sit. They're here until the late hours in the evening. They're here and available to us almost all the time. It's really helpful to have them here in the department because we as residents can go walk right over to them and talk to them about our patients and figure out the proper disposition for our patients. We also have pharmacy here in the ED. They again are a wonderful resource. They sit right here in the ED down with us and we can speak to them about our patients as well, and they can be very helpful with management. I'd also like to say that we do a lot of our own procedures here in the ED. So behind me have our ortho cart. We have a lot of our supplies back here for doing procedures. And we, as EM residents, take ownership of our patients and take ownership of our procedures. So we get to do, for the most part, a lot of the procedures for our patients, whatever they need.
Hi everyone, my name is Disha. I'm one of the residents here, and this is the green zone. It's a brand new area in the emergency department that was created for overflow when we have increased patient volume. This is emergency triage. This is where our EMS crews bring patients via ambulance, and it's also where we make critical and time-sensitive decisions. So for example, patients who are stroke alerts, we can activate a code stroke directly from ambulance triage after we assess the patient and then go with them directly to the CT scan.
Hi everyone, I'm Rodolfo, one of the residents here. This is one of our trauma bay. We have 4 of these that look just like it. Couple of questions that come up very often on our tours is who runs trauma in our emergency department. So the way we have set up is we work very closely with our surgical colleagues, and we do an odd even day run. On odd days, the emergency department will run the trauma, so you have the senior directly in the room, our second year performing our primary and secondary survey, and the surgical team will be doing procedures. On even days, we switch where we'll be doing the procedures while our surgical colleagues will be running the trauma. Any airway that comes in, the emergency department, we are in charge of all our airways. A couple of things to point out in the room. Here we have all equipments, including ultrasound, glascope technology, level 1 for blood transfusions, and all procedures, any kits that we need for trauma procedures are stocked in this room. And we also have the capability of connecting everything to the HDMI TV behind us so everyone can see when they're intubating or doing an ultrasound.
Hi, I'm David. I'm one of the residents here. Here you have our core area. This is where the most critical patients are seen. It's also where the doctors, nurses, and pharmacists sit for documentation. Having everybody in the same central area really facilitates communication between everyone in the department.
I just wanted to share with you some of our resident roles. So as an intern, you're not limited to a fast track or low acuity patients. You are responsible for seeing patients of all types of pathology who comes in. As a second year, your responsibilities do go up. You are the trigger resident. Our trigger patients are patients who come in with certain vital signs criteria, whether it be abnormal vital signs or trauma mechanism, and that will be seen primarily by the trigger resident. Higher acuity, and you become very efficient in that role. As a second year, you're also responsible for handling the online medical control. These are calls who come in through our EMS on the field, often asking for advice or any protocol. And as a second year, you have the help of an attending if needed, but you get the practice of handling online medical call. As a third year, we have a supervising role. That role includes staffing outpatients in the core, where you're serving as an attending in some ways. You get to read every single EKG done in the department. And we also are responsible for doing a sign-out process, which includes a medical minute, which is a brief teaching point with good pearls for the team, as well as signing out the entire department on the board, which allows you to practice that organization and supervision role in the emergency department.
All right, room 1 came in with leg pain and low back pain. Imaging is all negative. Will be dispositioned for physical therapy.
So right now I'm in the walk-in triage area, and one thing I want to touch on are the different resources that are available to us in the emergency department. So one big thing that we have is a dedicated emergency department psychiatry team. We also have a dedicated yellow zone for patients who come in with psychiatric complaints. And after we medically clear them from the emergency medicine perspective, the psychiatry team takes over and helps with their disposition. We also have case management, social work resources as well to help with their disposition. Another dedicated emergency department team we have is radiology. They're located right in the emergency department, and it's very easy to go back to the reading room and discuss a read or different types of imaging and scans with the emergency department radiologists. Another thing that we have available and that are located all throughout the emergency department are ultrasounds, like this one. We have several ultrasounds that are located in different hallways in the emergency department, like these mind rays, that are really easy for us to use, and we can use them to facilitate patient care.
Hi guys, I'm Nico. I really love working in this emergency department because of the teamwork. We're a well-oiled machine. The techs, the nurses, the residents, the attendings, we all work together, and it's a really fun place to be.
Hi, I'm Liz. I'm one of the nurses. We have an awesome residency program, as I'm sure everyone else has already said. We have a lot of awesome social events between the nurses and the residents. We have a great Christmas party. We have something called Skit Night. We have a sailboat cruise at the beginning of residency as an opportunity for everyone to get to know each other and mingle. And I just love watching the residents grow and develop and learn over their 3 years of residency here. It's been really fun to watch everyone.